Well, Eastern Cape health officials have been instructed to be aggressive in their response to COVID-19 and those cluster outbreaks. Newsroom Africa's Malungelo Booi in the Eastern Cape for us this afternoon. Malungelo, good afternoon to you. What's the Minister calling on officials to do?
Well, perhaps, Stephen, let's start here. Officials in the Eastern Cape are actually sending alarm, saying that the recent spike in COVID-19 cases really, if nothing drastic is done, this situation is likely to become a full-blown resurgence of COVID-19. So let's put things into perspective. Nationwide, we're told by officials that South Africa is currently registering on average about 2,000 new cases of COVID-19. Half of that, about 1,000, are found here in the Eastern Cape, and about 400 of those cases, of those 1,000 cases in the Eastern Cape, 400 are found here in the Nelson Mandela Bay municipality. And of course, officials are saying that what they've noticed is that people are essentially not adhering to social distancing and are also not wearing masks, and they're saying that there's something drastic has to be done to deal with this particular issue. And of course, Health Minister Dr. Zweli Mkhize telling those officials, Stephen, that they have to be aggressive on their response into this particular situation, saying that they need to go into communities and speak to people about the dangers of not adhering to COVID-19 health protocols. We already know, Stephen, that's what officials have told the minister, that they're finding that in public spaces, people are not wearing masks. And also some businesses, Stephen, including taverns, are also contributing to this problem, because patrons go into those spaces where there's no social distancing whatsoever, and also people are not wearing masks. The minister telling officials that they have to go into those communities and speak to people and actually tell them why is it important for them to maintain social distance and also to sanitize and wear masks, and also called on officials, actually saying that environmental officials from these local municipalities also need to be brought in, Stephen, and go into some of these communities and make sure that where these taverns actually operate and people are not adhering to lockdown regulations, those businesses are essentially shut down. Stephen.
Malungelo, I mean, the problem, of course, is what's happening in the Eastern Cape could easily move to other parts of the country. And also, let's be honest, it's not just people in the Eastern Cape and in Nelson Mandela Bay who aren't wearing masks. You see it everywhere. I mean, this is the huge concern for the minister. The last thing he wants is to see what's happening in Europe starting to happen here.
That's right. In fact, Stephen, officials and the health minister is actually more worried now that we're going to the December holidays. And bear in mind, Stephen, that the Eastern Cape is one of the holiday destinations. So you will find tourists coming into this province, and also some people who work in areas like the Western Cape and Gauteng will come back home during this December holidays to rest. And officials here in the Eastern Cape are worried also about that. In fact, Stephen, the minister went as far as to say he wanted officials from the Eastern Cape to come up with a concrete resurgence plan on how then they intend to deal with this particular issue. But also, Stephen, we've heard from some of the officials from this province saying that the staff, healthcare workers that have been treating people from March until now are actually also showing signs of fatigue. For example, in the Nelson Mandela Bay municipality, we are told that about 140 staff members have already contracted COVID-19. But I also want to bring your attention to this, Stephen. You can see the people that are behind me. Those are some of the healthcare workers, in fact, community healthcare workers that have been protesting outside that venue. That venue, that's where the health minister actually has been meeting with officials from this particular province province and in Nelson Mandela Bay region, discussing how they deal with this problem of resurgence. These community healthcare workers are demanding that government actually does employ them permanently. They're saying most of them, Stephen, are currently earning 3,500 rand a month, and they're saying that's simply not good enough, considering the fact that they are the ones who actually deal with the patient, with the COVID-19 patients.
Such a complex situation. The Eastern Cape doesn't have the same health capacity as Gauteng or the Western Cape. You've got community health workers who want something from the minister. You can understand the work that they do, very, very important. You've got a rising number of cases. You're trying to convince people to try and wear face masks. You've got taverns that are open. This is a complex situation. Is the minister getting the attention there from people that this needs? I mean, are people taking him seriously?
Well, Stephen, the minister has just been listening to some of the officials and also had few things to say. But I also think it is important to let you know that he also met with some of the traditional leaders. Now, that was an important encounter. I'll tell you why it's important, Stephen. In December, this is when we're starting to see young boys going through to initiation schools as they want to go through that rite of passage. And of course, those traditional leaders want that process, want to be allowed, want that culture, that part of their critical culture to be allowed. And of course, the minister saying that that issue is an issue that has to be dealt with by Cooperative and Traditional Affairs Minister Dr. Nkosazana Dlamini-Zuma. As things stand, Stephen, I really do not see a government allowing, the initiation to continue, especially in this province where we're currently seeing an uptick of COVID-19 cases.
Malungelo, thanks very much indeed. Do appreciate it. In Nelson Mandela Bay, the site of this uptick. We'll call it an uptick for now. The word we don't want to use is surge when it comes to new cases of COVID-19. Malungelo, thanks very much indeed.